This is AMP Live Studio. I'm your host, an RN and anatomy and physiology instructor for advanced healthcare pros. Today, we're going to unravel the really complex physiology behind a condition you will definitely see in your careers: attention deficit/hyperactivity disorder, or ADD. To really understand the science, we have to first understand the person. So let's start with a clinical scenario, because grounding this in a real-world story is always the best way to begin. So I'd like you to meet Leo. He's a really bright, creative 20-year-old college student. He's got so much potential, but he feels like he's just constantly struggling, just trying to keep his head above water with all the demands of school and, well, just daily life. Now, Leo's struggles are really specific. He turns in assignments and finds these simple, careless mistakes, even after he's proofread them. Trying to organize his study schedule, it feels impossible, and it usually just ends in a frantic all-nighter. And his keys, his wallet, it's like they just vanish into thin air every single day. During lectures, his mind just drifts off, and even when he's sitting perfectly still on the outside, inside he feels this restless motor that just won't shut off. And in conversations, he might cut people off or finish their sentences without meaning to. Now, these are not character flaws. They are clinical signs. So the big question for us is, what's actually going on inside of Leo's brain? Here's our plan for today. We're going to start with how the brain's attention systems are supposed to work, then look at what happens when they go off track. We'll connect that to symptoms, diagnosis, and treatment, and finally touch on how this is really a whole body condition. Okay, so to understand what's different in ADHD, we first have to appreciate the incredible systems that our brains use every single day to regulate attention and focus. Let's establish that normal baseline. At the very heart of all this are chemicals called catecholamines. Specifically, we're talking about dopamine and norepinephrine. You can think of them as the brain's master modulators. They're fine-tuning everything from our ability to plan and make decisions all the way to our motivation and just basic alertness. It's a very, very delicate balance. And what's really fascinating is how these systems are laid out. If you look on the left, you see the dopamine pathways. These are like super focused reward circuits, really important for motivation. But then on the right, the norepinephrine pathways are more like a global broadcast system, sending out signals for general alertness and attention all across the brain. They have different jobs, but they absolutely have to work together. So our brains have two main ways of paying attention. There's automatic or bottom-up attention. This is the effortless kind. It's what happens when you're doing something you love, something super interesting. That's run by the default mode network. But then there's directed or top-down attention. This is the hard kind. It takes real effort, like when you have to study for a tough exam or do your taxes. That requires what's called the task-positive network. And this is really the key to managing that effortful, top-down attention. I love this idea of a signal-to-noise ratio. Norepinephrine basically acts like a filter. It cranks up the volume on the important signal, the task you're trying to do, and it turns down the volume on all the distracting noise from everything else. This ratio is absolutely crucial for focus. Okay, so we've got our healthy baseline. Now let's explore what happens at the cellular and molecular level when this beautifully tuned system goes a bit haywire. At its very core, ADHD is a neurodevelopmental disorder. It's driven by a dysregulation of those catecholamines. This is not about a lack of willpower, it's a true biological imbalance of dopamine and norepinephrine in the brain's executive control hubs. And it's highly genetic. We're talking 74 to 80% heritability. Even at the cellular level, we can see differences, like a delayed growth of dendritic spines. Those are the little branches that help neurons connect. So if they're not maturing properly, it's harder for the brain to form strong, efficient communication lines. Let's zoom way in, right down to the synapse. So normally after neurotransmitters like dopamine or norepinephrine do their job, they get cleared out of that little gap by transporter proteins. You can see that on the left. This process is like a cleanup crew. It recycles the neurotransmitters and turns the signal off. A key part of the problem in ADHD is that this process is often dysregulated. So if we boil it all down, the main physiological problem in ADHD is just that: altered handling of these critical catecholamines. This means the signaling between neurons isn't as clean and efficient as it should be, especially in that all-important prefrontal cortex that's supposed to be in charge. All right, now we can start connecting the dots. How does this underlying pathophysiology actually translate into the things that Leo is experiencing every single day? How does biology become behavior? Remember those two attention networks we talked about? Well, in ADHD, that default mode network, the one that controls mind wandering, is often overactive. It doesn't power down like it's supposed to when it's time to focus. This creates a constant internal tug of war, making it incredibly hard to switch on that task-positive network. This is the real neurobiological reason Leo's mind wanders off during his lectures. We can actually map each core symptom directly to what's happening physiologically. Inattention, that comes from that poor signal-to-noise ratio we talked about, thanks to impaired norepinephrine. Avoiding tasks, that's from reduced dopamine in the reward pathway. It makes boring or difficult things feel almost physically painful to start. And impulsivity? Well, that's a failure of that top-down control from the prefrontal cortex to hit the brakes on our immediate urges. And when these challenges aren't managed, they can lead to some pretty significant long-term issues, affecting everything from school and work to relationships. There's also a much higher rate of other conditions, like anxiety and depression, which really highlights why it's so important to understand and address the core physiology. So, how do we actually use this physiological knowledge in the clinic? Let's take a look at how ADHD is diagnosed and how our treatments are specifically designed to target that underlying neurochemistry. The official diagnosis is guided by the DSM-5 TR criteria. For an adult like Leo, a clinician is looking for at least 5 symptoms from either the inattention list or the hyperactivity and impulsivity list. As you can see, Leo's challenges map almost perfectly onto these criteria. It's so important to understand that there is no single blood test or brain scan for ADHD. It's a comprehensive clinical process. A diagnosis requires proof that symptoms started in childhood, that they cause real impairment in multiple areas of life, like home and work, and that they aren't better explained by something else. This means detailed interviews, rating scales, and often talking to family members who've known the person for a long time. Okay, let's go back to our synapse picture, but this time, look at the panel on the right. This shows us exactly how the most common medications work. They are designed to block those dopamine and norepinephrine transporters. So by blocking the cleanup crew, they increase the amount of DA and NE that's available in the synapse, which helps to restore that signal and correct the imbalance. Now, while both main types of stimulants boost these neurotransmitters, they do it in slightly different ways. Methylphenidate mostly just blocks those reuptake channels. Amphetamines, on the other hand, not only block the channels, but also encourage the neuron to release a little extra neurotransmitter into the synapse. And it's not all about medication. There are some really exciting neuroscience-based treatments emerging. Things like external trigeminal nerve stimulation, which uses gentle electrical pulses to modulate attention networks. There are even prescription video games called digital therapeutics that are designed to actually train and improve executive functions. And neurofeedback, which helps individuals learn to regulate their own brain activity. So we focused a lot on the brain, but it's really crucial to remember that ADHD can have much broader effects. Let's just briefly connect this to some other body systems. We have to remember that dopamine and norepinephrine aren't just neurotransmitters. They're also part of the endocrine system's whole stress response. So it makes sense that a dysregulated nervous system can also lead to a dysregulated fight-or-flight system. This connection helps explain why so many people with ADHD also have a tough time with sleep and feel like their internal body clock is just off. Okay, let's bring this all home. Let's recap the entire physiological story we followed, from a single neuron all the way to behavior. So here's the pathway. We start with normal physiology, where the brain needs that delicate balance of catecholamines to function. Then we see pathophysiology, where genetics and development disrupt that balance. That disruption leads directly to the clinical presentation, the symptoms Leo experiences. And finally, the treatment logic makes perfect sense. Therapies work right at the synapse to help bring that balance back. And that brings us to our final and maybe most important question. Now that we have this deep physiological understanding of why these symptoms are happening, how can we, as future healthcare professionals, as educators, as colleagues, do a better job of creating supportive and compassionate environments for people like Leo? That is all we have for today. Stay patho-curious, and I'll see you in the next A&P Live Studio. This video is for educational purposes only and is not intended as medical advice, diagnosis, or a substitute for professional healthcare decisions.